Congratulations on achieving your pregnancy. It's so exciting to be pregnant, right? Yes, so now that you are pregnant, there are some things that you should look out for, because when you see these things, they are actually not too good signals, and it means that you need to report to the hospital immediately. So my name is Dr. Wala Aliritu. I'm a practicing medical doctor. I'm a family physician, and I dish out health content here on my channel. So please like, share, and subscribe to my channel so that you can be the first person to be notified whenever I drop a health content. Moving on, I'll be mentioning 7 things that when you see, you shouldn't joke with it. It means that you need to report to the hospital immediately so that you will be evaluated, the possible cause will be identified and treated immediately to ensure that we have a safe mother and a safe baby. So let's delve into some common danger signs in pregnancy. Number 1 is fever. Fever means elevation, increase in your body temperature. If you notice that your temperature is hot and you have a thermometer, you can measure it, and if you notice that your temperature is high, please visit the hospital. It could mean that you're having a malaria infection, chest infection, or even an infection involving your urinary tract. Okay, so fever is not a good sign. In fact, it said that when your body is hot, the temperature in your womb also increases and makes your baby in your womb uncomfortable, and that is not a good sign. Number 2 is vaginal bleeding. Typically, during pregnancy, there should be no form of bleeding from your vagina, and when you notice that there is bleeding from your vagina, please report to the hospital. I'm emphasizing on the need to report to the hospital because delay can be dangerous. Bleeding from your vagina can mean a whole lot. It could mean you're actually having a miscarriage, or the placenta has separated early, even before the baby is born. It could mean that your placenta is down in your cervix area, which is sometimes abnormal. It could mean a whole lot of others. Sometimes some people will even fall in pregnancy and begin to bleed. Once you notice any bleeding, whether small or plenty, from your vagina while you are pregnant, it is not a good sign and you must go see your doctor. The third thing is that there is this bag of water, a fluid that covers your baby in your womb, and it is protective. It has several functions. However, this bag of fluid, bag of water, should remain there until labor begins. All right, and usually labor begins from 37-38 weeks and above. And if you notice any gush of water, gush of fluid from your vagina, and you are not yet up to 37 weeks, immediately report to the hospital, because there are several things that can cause that, and you need to be checked by your doctor to protect you and your unborn child. The next thing you should check out for is a vaginal discharge. Yes, at intervals, you could notice some discharge from your vagina. Now, when you notice that this vaginal discharge is beginning to increase, becomes itchy, offensive, you need to report to the hospital, because we need to do some investigations, some tests for you, and we need to treat you for a certain infection that can be causing that discharge. Because if it is not treated, that discharge can spread to your child in your womb and cause problems for your child. And so do not joke with any discharge from your vagina. It gets to a time in pregnancy when you begin to feel that amazing movement of your baby in your womb. It's so exciting. It's so exciting. In fact, the first day I noticed that, like, you know, that feeling that you're carrying a being within you, it's really exciting. Now you need to be looking out for that movement. Over time, you will notice a pattern, or you will notice the activity of your child. If at any time you notice that the movement of your child is absent or is beginning to reduce, this child is not moving as he or she moves before, you need to report to the hospital. It could be one of several things, and you need to be checked and evaluated. Number 6, abdominal pain. Pain in your abdomen, especially when you're not in labor and you are not up to 37 weeks, and you begin to notice pain in your abdomen, immediately report to the hospital, because it could mean that you're having probably an early labor. It could be a sign of miscarriage. It could be a sign of so many other things that you need to be assessed. And finally, I've mentioned about 6 things you should look out for, but this list is not exhaustive. So as a general note, while you're pregnant, if you notice anything you are not comfortable with, like anything, no matter how dumb you feel it may be, please report to the hospital. And the emphasis is early. Report early. And if you report early, doctors to a large extent will be able to find out what the cause is and arrest it immediately, and your baby and yourself, you are fine. The goal of pregnancy is at the end of 40 weeks to deliver a healthy baby to a healthy mother, and I'm sure that is your goal. So if you have noticed any of these things and any other thing in your body that you are not comfortable with, please again, visit the hospital now. Do not waste any other minute. And I pray that this pregnancy journey will be the smoothest you've ever had. You will not have any form of problems, and at the 9th month, the exact day that God has chosen that your baby comes out, the voice of your baby and that of your own voice will be heard to God's glory. Amen. If you enjoyed this video, please like and share so that we can help other pregnant women. And if you have yet to subscribe, please hit the subscribe button. Until I see you again, enjoy your pregnancy.